I think I am sick.
Really? What is wrong?
I have a headache, fever, nausea, diarrhea, and I've been vomiting.
Let me check your blood pressure.
Okay.
Your blood pressure is low. Do you have any pain in your lower abdomen?
Yes, I have for the past day.
Is there a chance you were pregnant?
No, there is not a chance.
When was your last period?
Yesterday.
I think I know what you have. Let me give you a prescription to get rid of it.
Thank you so much.
You're welcome. I hope you feel better.
Our bacteria is Staphylococcus aureus. The meaning is a golden grape cluster berry. It's found in the normal skin flora and the skin and nasal passages. 22% of human population are long-term carriers of it. The shape is a spear and it's found typically in clusters like grapes. The reproduction is asexual. It reproduces DNA. The cells eventually divide into 2 new cells, and then before the new cells completely split, they form a cluster. It eats its victim for energy. Patients may experience a few days of mild-like flu symptoms before the disease develops, but the disease itself is characterized by the rapid onset of specific symptoms, including high fever, nausea, vomiting, diarrhea, low blood pressure, and a widespread skin rash. This will usually progress to a worsening of low blood pressure, dizziness, confusion, peeling of the skin of the palms and soles of the feet. Develops after 1 or 2 weeks of the rash, headaches, and the occasional seizures. Ultimately, multi-organ failure may develop, and this leads to death in approximately 5% of all those affected. Treatments for the disease include IV fluids to stabilize the blood pressure, possibly in combination with medications to raise blood pressure. IV antibiotics to fight the source of the infection. Oxygen administration. Removal of tampons, nasal packings, or other suspected sources of the infection. Surgical interventions to drain the source of the infection in cases of an abscess and remove narcotic tissue. And dialysis and kidney failure develops. If you are born with the disease, it will stay throughout your life. But if you get it using tampon or a nasal package, etc., it will only last until you get treatment.